Hello, Sean Atwood here, London-based author and activist. The coronavirus is spreading throughout this country now. It's in my neighbouring towns. A school has been closed down. A medical centre is being fumigated and cleaned. And if you've not seen the other videos I've done on this yet, I've done one about the coronavirus and Big Pharma, and I did one about the coronavirus and Wuhan's bioweapons lab and Epstein's mad scientists. So a lot of people are asking me to give my opinion on the more conspiratorial side of this. I'm going to describe what's happening in the UK as well later on in this video. So, from my research, all I can say is what I know for sure is that the people in power, the elites, never let a good crisis go to waste. I'm going to get to that. Now, regarding the origin of the virus, has it crossed over from the animal kingdom? Did it escape from the weapons labs, these bioweapons labs that they have in China? Was it released intentionally as part of an agenda of global depopulation? So there's all kinds of theories going around, and I don't think anybody can absolutely know for sure, because diseases have battled humankind ever since we've been alive. And I said in the previous video, bacteria have been around for billions of years. They look at us as short-termers on the planet. They are far more durable, and they've come up with all kinds of crafty ways to periodically outsmart us. Our immune systems, they register their latest tricks, and we learn mechanisms to defend ourselves. But then the bacteria, biding their time, they come up with something completely new to get around what we've set up in our immune system. So, the other thing I said in a previous video was that the media hypes things up, and we will only know when this is serious if the stock market starts to crash. And we have seen hugely steep falls in the stock market in the last week. So when the traders start to take it seriously, we know that the global economy is at risk. So it is a credible threat. A lot of people say, no, it's just like getting the flu. The flu kills way more people. The stock market hates uncertainty. We already know what the flu is all about. In the beginning, they said the coronavirus, you could have it for 14 days without showing any symptoms. Then people started to show up with symptoms after 20 plus days. They said that people are now getting it in areas where they have not come into contact with anyone. It's not believed they've come into contact with anyone that had it, so they can't even trace where it's coming from. So it's fear of the unknown panics investors. And yet, like with SARS, when they got SARS under control, if they can get this under control and stop it from spreading, the stock market will, in all likelihood, bounce back really strongly. But if it tips the global economy into a recession or a depression, then because the economic machine is breaking down, I mean, if you're closing schools, cancelling sports events, cancelling flights, look at all of the businesses, the restaurants, the tourism, all this stuff comes to a grind. The money's not coming in. People can't pay their bills and they can't spend. This is going to show how fragile things really are, because human existence and the things we take for granted, we really are on the edge of a knife. But I don't think that because we take it for granted, I don't think that people look at it like that until wartime or until there's some kind of a catastrophe, and then it all reverses and people go through hardship, they learn, they come out with the lessons learned, but then the future generations forget what it was like to go through that until something bad like war or disease running rampant happens to them again. And these cycles have been around for time immemorial. So, you know, whether this is Mother Nature, whether it is snuck out of a lab to depopulate the world, whether it's just escaped, politicians, they always capitalize on a crisis. Never let a good disaster go to waste. So what we are seeing now for sure is the political mafia, you know, trying to capitalize on this. I'll give you an example. So Trump, the stock market was running high. Trump was engineering the economic growth, the low unemployment, to be in good standing to win the next election. So now that the coronavirus has caused the stock market to collapse and economic growth is in jeopardy, then there are definitely forces at work to use that to their advantage to try and get Trump out. Maybe the residual of the Hillary Clinton camp and whoever's being groomed to take over from that crime family. I've said in other videos, I don't vote and I don't trust people at the top of politics. You've got to be a psychopath to get to the top of politics. And I view the Bushes, Clintons, Trump as all different types of crime families. I don't see how they're different from the Bonanno crime family, the Gambino crime family, or any other. In fact, they cause more death around the world with wars and chaos and mass incarceration. They cause more harm to people than the gangsters like the Bonannos and the Gambinos are small time compared to what these politicians can do. The other thing is, the New World Order are interested in controlling the population. So whenever there's a crisis, they can announce emergency measures and bring in new laws and restrict people because it's for the good of society that the coronavirus is contained. Look at all the people locked down in China, all the people locked down in cruise ships. And if it does get really out of control, we could see some kind of martial law. So, you know, any day now, it could become under control. The weather could change. It could start getting warm. Seasonal factors could affect it. And all these headlines we're seeing now of hell on earth could just appear as pure hype. But nobody has a crystal ball. Because if you did, you'd know exactly when it would turn, and then you could buy the stock market back before it bounced right back up. But nobody has that ability. You know, even the experts didn't comprehend that it was going to outdo SARS like it has done already. So, how far will it go? Lord Rothschild's, his thing was, in the stock market, was buy when blood is running in the street. So buy at the bottom of a disaster. So, unless you're a fortune teller, I'm just going to have to sit back and watch how this is playing out. And how it's playing out in the UK is that, in the latest news here, 3 more patients tested positive. Cases now in the 20s, and over 10,000 people in this country have been tested for the virus. So it's just getting started here. 2 of the first patients travelled back from Italy, another returned from Asia. And this is the Chief Medical Officer, Professor Chris Whitty, made this announcement. So, 3 cases, Gloucestershire, Hertfordshire, Berkshire, are being investigated. And here in the county of Surrey, we've got Hazelmere has been hit and Farnham has been hit, which is just about a 10-15 minute drive from here. So I imagine it's going to be here in the town where I am any moment now. Public Health England is not clarifying which of the two had returned from Italy and which returned from Asia. And the government is bringing in emergency powers. What did I just say? To help stop the virus spreading after 10 cases came about in 3 days. And they're testing over 1,000 people in a 24-hour period now. Emergency powers are giving schools, councils and parts of the public sector powers to suspend laws, including health and safety measures to cope with a pandemic. There are fears of an explosion of cases in Surrey. So I am in the county of Surrey. If you're in America, England's divided up into counties, like you guys are divided up into states, just on a smaller scale. I'm in the county of Surrey. An unknown coronavirus spreader in Surrey gave the deadly illness to the UK's 20th victim, and that was the first person from this country not to have caught it from travelling abroad. The victim is a man who was treated at Hazelmere Health Centre before being transferred to Guy and St London's Hospital in London. And this is the health centre where I think they're fumigating the hell out of it now. The guys in the white suits are going in, the hazmat suits. So, former Health Secretary Jeremy Hunt confirmed a GP thought to work at the health centre fell ill, showing symptoms of the infection, and spoke of a worrying time for those in the country. So that was a doctor at the health centre. So in this country they're telling people, if you've got it, don't just bomb into some health centre and give it to everybody else. Don't just go into some hospital and give it to everybody else. There's special measures now where people will come out to your cars in suits, swab you and do all this stuff. In Liverpool, which is my hometown, Widnes, Cheshire, is quite 20 minutes away from Liverpool Centre. A city centre hotel has been hit by coronavirus fears after a guest self-quarantined in the hotel room after falling ill following a trip to Thailand. So in this country they're recommending people self-quarantine. We're not seeing a widespread panic where everyone's just bombing it into the supermarkets and grocery stores to buy loads of food. Other parts of the world that has been occurring. I'm sure there's been a run on purchases of the mask. So the male guest in Liverpool staying at the Radisson Blu on Old Hall Street for the last 3 days, he began presenting symptoms similar to those of coronavirus. The guest had rang 111 and was waiting for a health professional to be sent out to assess him. So that's what they're saying, ring 111. Emergency laws are being rushed in to ensure public services and the transport network can keep on operating. I'm supposed to go to London on Friday. It's in London. Whew, I'm in two minds as to whether to get the tube and the train, because if someone's got it on the London Underground, that's just going to incubate and spread like crazy. If I go in my car, at least I'm self-quarantining. So my sister's got her new book out, A Girl with a Gun, about a woman in Iran who would get the death penalty if she went back to Iran, Peshmerga fighter. And it's my sister's book launch on Friday in London. So a book is available worldwide on Amazon if you're interested in that. It's a hell of a story. Scientists are fearing coronavirus could be 1,000 times more infectious than SARS, which only killed less than 1,000 people worldwide. We're already in the low thousands now on coronavirus. 1 in 10 Britons could be hospitalised with coronavirus, according to the National Health Service, who are preparing for the worst. Fears a doctor has been affected, but it's waiting to be officially confirmed. More than 1,000 workers at the London offices of law firm Baker McKenzie in the financial district were sent home after an employee returning from Italy fell ill. France cancelled a gathering of 5,000 people or more in a bid to contain the virus that is rapidly spreading across the world. And the World Health Organization has raised its risk level to the highest. It's in 59 countries, over 3,000 killed, 85,000 infected since the explosion in Wuhan. In Scotland, over 100 people a day are getting tested. No confirmed cases yet, but that's going to happen any minute now. On Friday, NHS Lothian announced this has introduced a drive-through testing centre for the virus, so you don't go in and get everybody else sick. Some patients with an appointment are being tested for coronavirus in their cars at a hospital in Edinburgh. It comes after a patient was confirmed on Thursday. Well, that's the Surrey one, who had returned from Milan, but had not travelled to the core virus hotspot areas of northern Italy. So they're closing the schools in these areas in Surrey, and authorities are now racing to track down the spreader to avoid them contaminating more people. It's not known whether they had arrived in the country from abroad, where many countries including Italy, South Korea, Japan and Iran are firefighting outbreaks. What are they going to do? Just completely stop all air travel so people can't bring it in? Imagine being on a plane and someone's got it. And even worse, in a prison. I've done numerous videos about the lack of healthcare in prison. Prisoners aren't even considered human beings. So, heaven help people once it gets into prison. So, there are concerns that Surrey, my county, is a disease hotspot. The doctor saw loads of patients before he fell ill, that's according to The Guardian, so it's probably been transferred to all these patients, but you've got the incubation period, which we thought was 14 days, which could be anything now, in the 20-day plus level. So all this is yet to come out. So, Mr. Hunt, the MP for Farnham, this morning tweeted, that's the town next to me, thinking of clinicians, staff and patients at the Hazelmere Health Centre. Worrying time, but I know local NHS and Surrey Council working tirelessly to keep everyone as safe as possible. Thoughts today with the new COVID-19 patient and local GP with symptoms, alongside their families. So, local people said that when visiting the Surrey surgery, staff suddenly told them the medical centre needed to be closed for an urgent deep clean. One told Surrey Live, quote, "I was waiting on my own, keeping my distance from others. At about 8:50 AM, they announced that someone had been taken unwell and they were shutting for a deep clean. There were about 10 of us in there at the time. I phoned them and they said no appointments are being made until Monday. I spoke to a GP and they said not to worry about air exposure, but there is a chance they may clean it. After the deep clean, that health centre has reopened. The school near me that was closed is All Hallows Catholic School in Farnham and St Peter's Church of England Middle School in Old Windsor. They're closing as a precautionary measure. Flurry of cases, including in Northern Ireland and Wales. And Health Minister Edward Argar is refusing to comment on reports that the first person to contract coronavirus in the UK also passed it on to the doctor. He said, quote, "It is a new development, but the Chief Medical Officer has also said, we are still doing the contact tracing around that, and we are still looking into the details of that case. So it is probably a bit premature to say more than that at the moment." So these politicians, if they are trying to minimise things to the public, that's the absolute worst thing that they can do. They've got to get on top of the situation. And who's Trump got? Is it Pence? He's no doctor. He's no medical expert. So it's quite worrying. You know, America spends all this money on healthcare. It's got some of the sickest people in the world. Are they really interested in stopping this or profiting from the disaster? we'll see what happens on that front. Boris Johnson is saying he's got a grip on the health crisis, and preventing a major British outbreak was the government's top priority. The government has drawn up a worst case scenario strategy involving deploying military medics to hospitals, the emergency laws, suspending class sizes, allowing teachers to take on pupils when colleagues are off sick. Boris Johnson is being branded a part-time minister for his slow response. He's reassuring the public that he had held meetings with the health secretary and chief medical officer who broke the news of the country's 20th case. Professor Chris Whitty said in a statement, one further patient tested positive. The virus was passed on in the UK. It's not yet clear whether they contracted it directly or indirectly from an individual who recently returned from abroad. And like I said, all these flu-like symptoms being experienced. Experts are reacting, saying it's marked a new chapter in the UK's battle across the global epidemic. Professor Jonathan Ball of Molecular Virology, University of Nottingham, said, quote, "This case, a person testing positive for novel coronavirus with no known link to an affected area or known cause, is a new chapter. And it will be crucial to understand where the infection came from to try and prevent more extensive spread." So it was almost snowing here. The weather is still quite cold, and that is conducive to the spread of these things. Look at seasonal flu. If warm weather starts to kick in, you know, maybe this thing will start to die down and things will return to normal and we won't have a zombie apocalypse scenario unfold. So, if you haven't seen my other videos on coronavirus, I've got coronavirus and Big Pharma, coronavirus and Wuhan's bioweapons lab, and Epstein's mad scientist as one video. All my Epstein stuff and my conspiracy theory stuff and my true crime podcast are in the description box below this video. If you're enjoying these videos, please subscribe. Subscription logo is the bottom right hand corner. We're almost at 400,000 subs right now. The more subs, the more leverage I have with YouTube and promoting the true crime podcasts and keeping everything, the momentum going solidly. Huge thank you to all the people who've donated on PayPal, Patreon, Just Giving, Subscribestar. All those links are in the description box below this video. Really enjoy reading all of your questions and comments, and I hope you've enjoyed Mike Tarraga Part 2, Teddy Victim, just went up on the podcast. It is True Crime Podcast. It's called Meat Rack Boy Part 2, and also the podcast with Sharon Gale, whose baby died in hospital. Absolutely heartbreaking story. I'll put the links in the description box for both of them as well. Hours and hours of content. Alright, cheers from London. Take care out there. Thank you.